Normal life is me just full-time school, and then my wife just full-time wedding videographer, and then we had a little baby girl, 2 months when I got diagnosed.
It's our first child, so we've dreamed of this, we've talked about it. I mean, you plan it in your head your whole life, and you think like, we're gonna have this baby, we're gonna move into this nice place, we're gonna raise our kid together, and we'll switch off who gets up with her in the night, you know, and all of that just goes out the door.
I was riding my bike home from school and crashed, and my back just started hurting like crazy, and I kind of just was like, oh, maybe it's just from my bike crash, and we went to the chiropractor, and then things didn't get better, and then all of a sudden my arms started going numb. And so I went to the ER, and they kind of checked me out and said, oh, nothing's wrong with your arm. And then it was a week later where like I woke up and I could barely walk. My back hurt so bad. Then just scan after scan after scan, seminoma and non-seminoma testicular cancer. So, or germ cell tumor is what they call it if it's not originally from your testicles. Emotionally, it's just like, holy cow, like what's gonna happen with my life, right?
Having a 2-month-old when this all went down was so hard, just because for me, I was told Colten, I feel guilty no matter where I'm at. If I'm at the hospital, I feel guilty for our child. If I'm at home with her, I feel guilty for Colten because I need to be at the hospital, and it's a constant battle.
They started with radiation for a week on my back, because it had metastasized to 2 of my vertebrae. And so they started with radiation there. After that, it was 4 rounds of VIP chemo, is what it's called. And so when things kind of came back, relapsed, right? Tumor markers started going back up. They said the best option was to come out here and be treated by the people that treat it the most.
In that setting, the only chance for cure is to go through high-dose chemotherapy with what used to be called bone marrow transplant, but it's been gentrified, and it's what we call peripheral blood stem cell transplant. So what that means is we can give 5 times the dosage of chemotherapy, which would be impossible if we didn't collect the patient's blood cells, which we do by just taking blood out, like being a blood donor, but here you're being a blood donor to give the blood cells back to yourself. And then we can give the high-dose chemotherapy, followed by giving them back their healthy blood cells, and then 3 weeks later you do the same thing. We do this type of treatment probably more than anyone in the United States, if not the world. This is not me, this is our specialized nursing service and the excellent ancillary care. We have infectious disease and everything else. So giving standard dose chemotherapy, as he had in Utah, can be done pretty well by many oncologists as long as they follow the guidelines. But high-dose chemotherapy requires a great deal of specialization and is best done at tertiary centers that know how to do this properly. Here we can see patients, look them in the eye, and tell them that the goal of this therapy is not to relieve symptoms or not to make you live longer, but the goal is cure.
Dr. Einhorn is kind of the reason why I came out here.
And that's been a huge comfort to know that he was on our case from the get-go, and to know that, like, well, we have the best of the best, so no matter, you know, what happens or what he asks us to do, like, we're gonna do the best. Like, we have the best of the best to take care of him.
I had spent Father's Day, my first Father's Day, being a father in the hospital, but she was able to come and visit me, and it's just a bright, happy moment in a sea of darkness. Now my cells have been grafted and growing like normal, so it's just recovery now. All goes well with labs. This week we'll be headed home.
Right now he's in a complete remission. So when someone is out 1 year from now, we're pretty sure they're cured, but until he's out, that 1 year level is still uncertain.
Finish line is evading me, it seems like, as it does with these kind of things, you know, you just never know. But it is a huge milestone. The first year of your kid's life they change so fast. I mean, from learning how to crawl to learning how to walk to first words, I mean, all those things happen really fast. And I mean, I don't want to miss that. I don't want to miss being present as a father.
It's really beautiful to see him be even here and be a part of life, you know.